When you turn 65, you'll have many important decisions to make regarding your Medicare coverage. One of the most important decisions you'll have to make is whether you're going to keep original Medicare or replace it with Medicare Advantage. Now, we do a lot of videos about Medicare Advantage, also known as managed care plans or Medicare Part C. And today we wanted to discuss a recent warning from the Mayo Clinic that all Medicare beneficiaries should be aware of. And as usual, please make sure to subscribe, that way you stay up to date with these kinds of updates. And of course, please make sure to give us a like, click that thumbs up button so we can get this information out there. So what are Medicare Advantage plans? Well, Medicare Advantage plans are an alternative to original Medicare. So they replace original Medicare entirely. They're offered by private carriers, and they must offer at least the same benefits as original Medicare, which is Medicare Part A and Medicare Part B. However, very often they offer additional benefits as well. Things like dental, vision, hearing, prescription drug coverage, and more. Now, as I said, these plans are offered by private carriers, and unlike Medigap plans, they are not standardized. So benefits and costs can vary widely. However, all plans will impose some type of out-of-pocket maximum, which is not offered by original Medicare. Additionally, these plans may seem to come at a lower cost. In fact, many plans will claim that they are free. Now, are they free? Of course not. At the very least, you still need to continue to pay for Medicare Part B. But with these added benefits and often lower costs, it's easy to see why some people can be enticed by these types of plans. Very often, these plans seem too good to be true. Usually, they have additional benefits not offered by original Medicare, and very often, when you compare the monthly premiums to a Medigap plan, they seem to save you money. Now, that's because Medicare basically will pay these private carriers to take on your risk. And there are certainly downsides, which we discuss in other videos, chief amongst which is the fact that you will have a network. So Medicare Advantage plans operate as either HMOs or PPOs, which means they will have some type of network that you need to be aware of. This is in stark contrast to original Medicare and Medicare supplement plans. And this is where the warning from the Mayo Clinic comes into play. More on that in just a minute. So with Medicare Advantage plans, you will be beholden to some type of network. This is not the case with original Medicare and Medicare supplement plans. Almost all doctors and hospitals accept original Medicare and therefore will accept your Medicare supplement plan. And you can choose a Medigap plan, Medicare supplement plan, to fill in those gaps of original Medicare. Basically, even with original Medicare coverage, you still have to concern yourselves with deductibles, coinsurance, and copays, and that's where Medigap plans come into play. For example, Plan G, which is the most comprehensive coverage offered to new enrollees, will basically cover all of your additional costs except for your Part B deductible. So there's no additional coinsurance or copays to worry about, or a Part A deductible. Plan G will also cover your Medicare Part B excess charges. Basically, doctors and hospitals who accept Medicare must accept the amount that Medicare is willing to pay out. However, they can choose to charge up to 15% more. This is what's known as a Part B excess charge. So Plan G will cover those Part B excess charges, but Plan N will not cover those Part B excess charges. So why do you need to know this? Well, we're talking about the Mayo Clinic today, and although Part B excess charges are quite rare, the Mayo Clinic does often charge those Part B excess charges. So it's just something to take into consideration. So now let's switch gears and talk about the Mayo Clinic's warning to Medicare Advantage beneficiaries. As I mentioned earlier, Medicare Advantage can operate as an HMO or a PPO. And the Mayo Clinic would like beneficiaries who have visited their facilities in Florida and Arizona to know that they will no longer be contracting with Medicare Advantage HMOs. So, except for very rare occasions, if you have an HMO with Medicare Advantage and you live in Florida or Arizona, you won't be able to get an appointment at the Mayo Clinic. They recently sent out a letter to current and past patients from the last 3 years to warn them of this policy. At Mayo Clinic, our parents are at the center of everything we do, and your trust is very important to us. Sharing information is one way to help ensure we continue to be trusted partners for your healthcare needs. As you may be aware, beginning in mid-October, it will be time to select healthcare coverage for 2023. Mayo Clinic in Florida is not in-network with most Medicare Advantage plans. We want to be sure that you are aware that Mayo Clinic in Florida will not schedule appointments for patients with out-of-network Medicare Advantage plans. Many patients are making elections for their coverage in 2023, including Medicare. Marketing for Medicare Advantage plans may indicate that you can be seen at any facility that accepts Medicare. However, Mayo Clinic in Florida is out of network on these plans. Medicare Advantage plans are managed by commercial insurance companies on behalf of Medicare and offer a specific network of contracted medical providers and hospitals, which may not include Mayo Clinic in Florida. These plans are required to have a substantial network of qualified providers to accommodate their members' medical needs. As you consider your options for health coverage, you can confirm Mayo Clinic's participation by providing the insurance plan under consideration the tax ID information below, and then it lists the tax ID information. We do accept original Medicare, which we mentioned earlier in the video, Parts A and B, and supplement plans, sometimes referred to as traditional Medicare. If you choose to enroll in a Medicare Advantage plan, we can provide your medical records to the next in-network facility you select for your care. Now, if you've not been a patient of the Mayo Clinic in the past 3 years, you probably were unaware of this. So why is this even important to you? Now, this is reflective of a larger problem with Medicare Advantage plans, and that is, of course, the networks. Now, it may not seem like that big of a deal to you. If you've had group health insurance in the past or even a marketplace plan, you've probably had to operate within a network. So why is it important now? The truth is that as we age, our medical needs tend to change. And of course, if your medical needs are more extensive, as they tend to be in our older age, you really want to make sure that you have access to any doctor or hospital that you wish to use. Now, should you keep original Medicare and possibly supplement your coverage with a Medigap plan, then you will pretty much have access to almost any doctor or hospital that you wish to use. And this is just not the case with Medicare Advantage. Now, of course, it's possible that this might never affect you. However, not being able to utilize the Mayo Clinic can be a major detriment to your health. The Mayo Clinic is consistently ranked in the U.S. News and World Report rankings of top hospitals. And the Mayo Clinic is regularly acknowledged as amongst the very best hospitals in the nation in cancer treatment, cardiology, pulmonology, neurology, and pretty much everything else. So if you are considering making the switch this year to Medicare Advantage, please take this into consideration, especially if you live in Florida or Arizona. Regardless of what you choose, if you need any help, please feel free to contact us at the number on the screen. There is absolutely no charge for our services, and we are licensed nationwide, Florida, Arizona, and all of the 50 states, and we are more than happy to help. And as always, please make sure to click that subscribe button because we do release these videos with Medicare and other health insurance updates on a regular basis. And of course, make sure to click that thumbs up, give us a like so we can get this very, very important information out there. Thank you so much for watching and have a wonderful day. Bye-bye.